After a treatment, usually the client will be sitting in the treatment room and I will come back in. I'm gonna actually ask them to stand up again and do at least front facing, if not also side body reading. And I wanna see if anything changed. Hopefully something did. It might not always, but if it does, it's really good to point it out to the person and let them feel it in their body. A lot of people, they'll feel the treatment, but they won't internalize it and really notice the change. It's like the minute they get off the table, they're like off to work or thinking about their grocery list or something. And so you do want to help them notice what happened. I'll have a client stand, right? And the very first thing I notice, if we were to like literally go A-B from before, and I think we can do that with video editing, is how much more three-dimensional her rib cage is. And their sternum and this top part between the shoulders is really much more open and moving and lifting those, instead of this sort of more collapsed thing that she had before, right? The feet are a little bit more in line this way. The left foot's not backwards in space. They're still slightly externally rotated, but I notice, and you can't see it on camera, the arches are a little bit higher and a little bit more grounded and lifting. Do you feel like your feet are a little bit more grounded into the floor? Great. And those are questions you should ask to clients. They might not notice it, but now she does, and she'll be like, oh, yeah, actually that does feel different and better, right? And so, but the main thing for me is that the ribs and the breath are moving again, and so the shoulders and neck get to relax a little bit more. This pelvic rotation where the left hip was more forward has actually sunk back, and even with the line of the folds of the shirt, you can see that the right hip isn't as hiked anymore. Does that mean your pain will go away forever and ever and ever? No, probably not, but it should feel a little bit better. And we can now start to talk about homework to help her capitalize on this, and then a treatment plan of follow-ups to help make it last long term. And I will be very honest with clients at this stage after a first session and say, this usually lasts maybe 2 to 14 days, right? And so we want to get back in there and do follow-ups. So for you, the very next thing I might do is a side body session. We've still got this sense here of these ribs really pulling in, and so I might want to do some work to open up that. That is one option. We didn't really get into your jaw, but there's definitely some stuff going on up there that's part of the headache stuff. We did some prep work on your ankle down there, but a lower leg session from just the knee down for an hour would be pretty revolutionary for you, right? And those are just like maybe the first 3 things that pop into my head. I might come up with a 5 to 8 sequence, but even if you just give a few like that, that's more than enough for them to go, oh, I see. Yes, follow-ups are gonna help. The things that you're suggesting are different from each other, so it's not just the same thing over and over hoping something changes, and that there's a sequence idea to it. So that's usually a bit more enrolling to the client, and they get, oh, right, this is actually a plan and not just like, I'll just do whatever I feel like and hopefully you'll feel better, right? Part of this process, so let's say treatment, then we have a little bit of body reading. Before I get into the plan, I do want to give 1 or 2 pieces of homework, right? And for her, the first piece of homework I'm going to give is just breathing up here and then thinking of the exhale just being a letting it go, right? Like I noticed on the table, and I didn't say it potentially, but I could have in treatment, that like you hold on to your exhale all the way down. And you could just let it go. That's extra tension you don't really need unless you're hiding from a velociraptor, you know. So that would be homework piece number 1. Just notice the breath in the collarbones, expanding wide and collapsing, expanding wide and collapsing. Yeah, great. That's gonna help your neck immensely. All right, now for your low back, I'm gonna show you my favorite stretch, which we have in this video somewhere. I'm gonna point somewhere, maybe we'll use that or not. But okay, so try this out next to me. So I'm gonna cross into a figure 4, and I'm gonna think of everything from my belly button down as just rolling away from the opposite shoulder. And the goal would be to try to keep the ribs on the floor. And this is a nice passive stretch for your hip. You should feel this in the glutes. And you'll get a subtle lumbar twist here and a subtle lumbar stretch. And you really can just hang out here as long as it's comfortable. And if you have a friend or a partner, they can even come in and give a little extra. So there are your 2 pieces of homework, right? And doing that maybe a minute a night, 30 seconds on each side would go a long way to like holding the gains that we got today and making the length of the relief of the treatment last a lot longer. And my goal with those homework pieces is to give them 1 or 2 new ones each session so that you start to build up a library of self-care tools that really work for you. I could be like a PT and give her a page of like 10 exercises that take 3 hours to do, but nobody's gonna do that. I won't do that. Nobody does that, right? And so it's a lot better to just start with something, a couple simple pieces that they can learn quickly and really get something from. And even then, a lot of clients will come back to session 2 and be like, well, I tried it once, and I'll be like, good job, you know? And then you just remind, hey, try that again. Here's something else as well, right? So then, how are you feeling? What happened? How was that? What was that experience like?
It was very intense. I feel looser. I feel like I can breathe more. I didn't realize how tight I was in the front. So yeah, I'm feeling good.
Cool. How is the right low back?
It actually doesn't hurt right now, which is really nice.
That's amazing, and high five. There we go, right?
Yeah.
Now, I asked that for a very specific reason. In the intake, I asked her what her main goal was, and she said her low back. So now I'm checking in. How is it feeling? Is it any better? It might not be. There are sessions where it doesn't magically feel better and you need to do follow-ups. But if you ask and they say, yes, I don't feel any pain, that's really big, right? That's a huge thing. And I will then be honest, hey, that's not gonna last forever. But if we follow up with some of these other things that I talked about, there's a good shot that we could get it to last for a long time or forever, right? How does that sound?
Sounds great.
Great. Now, my recommendation for those follow-ups would be 2 weeks or less. We want to get back into the tissue while your brain is still confused by what we just did, right? Your idea of the alignment of your bones and your muscles, we've just changed that. And your brain is literally confused by that. If we give it more time than 2 to 3 weeks, then we get past the point where your brain is confused and it returns back to what it knows. And so the idea is to intervene before it all just snaps back to the old pattern, right? And it doesn't mean that it's going to be one a week forever or once every other week forever. It's more like 3 to 8 sessions, depending on the client. And you'll know as we start getting into session 3 to 5 that things are starting to last a lot longer. We probably at that point can spread the sessions out a little bit more, maybe 3 weeks apart, 4 weeks apart. And then at a certain point it will feel like, yeah, this is settled into a new pattern. Maybe we talk about a maintenance session every 6 to 8 weeks or even 8 to 12 weeks for a lot of people. Or I don't see you for a year until something else falls apart and then you come back. And all of those are reasonable options, but at least I can tell you you've got a way better chance of this sticking in feeling better and staying feeling better if we do follow-ups sooner rather than waiting a month or 2 before you come back, right? If we do that, then it's more like I have to start over and we don't really get any kind of a cumulative layering effect that could really make this last long term. So, how does that sound?
That sounds good.
Great. Do you want to look at the calendar?
Yeah.
And, you know, I get that she's on camera and I'm not trying to force it, but that's actually what I would then ask a client and say, hey, all right, well then great. It sounds like you're into the idea. Let's look at the calendar. How's next Thursday at 7:15 p.m.? for 60 minutes, right? And then you might say that today's session was that time, next week, same time. Work for you? Great. No, not, then you start working on the logistics at that point. But by that point, that's all just problem solving. So let me highlight the exact sequence I got to her saying, yes, that sounds like a good idea. I did a very thorough intake, but within a short period of time, I really listened to her and I repeated back what the problem was. So she understood that I understood what she was dealing with. I then did some body reading to see if I saw anything that maybe was a seemingly unrelated but actually related other cause, like that left ankle sprain, right? And I pointed out some misalignments, and I then asked you if I do this treatment that I think, how do you feel about that? And I got your agreement on it. Then we did the treatment. Then we did some body reading. We asked you to notice what's different, what feels better, because you're a dancer, you're probably very body aware, but a lot of people really need you to tell them to feel in order to feel, right? And so you felt the difference, you noted it and said, oh, wow, that is better. And then I really was honest about how long that realistically would last just with the one session, and really highlighted that, no, it's not normal that this was fixed now. We need to do some follow-ups. Then I offered at least 3 ideas of potential follow-ups that I could see to intervene. You could even just start with 1. And then I gave you a basic outline of a treatment plan. 3 to 5 sessions, 1 to 2 weeks apart. We'll start spreading them out as we get a little further along, and then we go into a maintenance cycle. So I presented the entire thing in such a way that you got it, and something in your brain went, yeah, okay, I think that might be a good idea, right? Like, I actually saw on your face that was an honest answer, not an I'm on camera with my boss answer, right? And so then I've got the enrollment from the client in the plan. Then it's just the logistics of, all right, let's get something on the calendar, make it work. Sometimes you will get some objections to that, like, I have to check in with my family, or I'm not going to be in town for another 4 weeks or something, but you deal with those and you get somebody on the calendar back, and you just honestly talk about, like, how can the plan work best for them. And that might mean, with some clients, they might want to come twice a week because they're just like, let me get in there and get this fixed now. I'm totally committed. Other clients, maybe once a week. Some clients are like, ooh, this is a budget problem for me, but I think I can come every other week for at least 3 sessions. And you're like, well, that will make a difference. Let's do that. And you might see how they feel later in the series. They might, after a few more sessions, be like, screw it, let's keep going, right? Or they might be like, I'm gonna get my mom to get me a gift card for a 5-pack. Who knows, right? Like, but the point is, you've given them a professional assessment of what you think will help them. You've presented it clearly and cleanly. You've not pressured the client. You've just presented what you think will help, and then asked, are they in or are they out, right? And then again, it's just down to logistics. If they're out, and this is something, if they're like, no, I gotta think about it, or I can't feel any difference, let me see how I feel in a few days, that's fine. You don't need to argue with them, but then you can ask, would it be okay if I follow up with you? Right? And then if they're like, yes, then you can email them in 3 days and see, well, how are you feeling now? And you may get a good response to that or not. But that's the entire sequence, and literally in that rebooking skills check workbook that we have, that is what we just did. We did, hi, nice greeting, intake, treatment, outtake, and then follow-up, right? And all of those stages need to happen to get to the point where the client, most clients, not all, will be, yeah, you know what, that sounds like a plan, I'm in. And that's your goal, right? And then not even for you, for them, because that is the thing that would make you not feel this again in 2 weeks.
Yeah.
So, do you have any questions?
Not right now.
That's cool. Do you have any questions? Leave us a question in the comments, let us know what you think, any strategies, any particular scripting or language you use with these different steps. Totally, I have my method, but yours might be really cool too, so I'd love to hear what you think in the comments below. If you liked all of this, check this video out too.